Imagine for a moment that your house burned down. And after the fire department came to put out the fire, and 3 weeks after the incident happens, you open up your mailbox and you find a bill from your fire insurance company for $3,000 because they're saying that the fire department that you used was outside of network, and you called 911 and had the fire department come out there without pre-approved authorization. And so because of all that, you were liable for the $3,000 cost that it took to get the fire department there to put out your fire.
Wow, that's dark.
Now, collectively, I think we can all agree that something like that would be absolutely insane. But meanwhile, a very similar experience happens to millions of Americans every single year with our healthcare and health insurance industry. And I know a lot of my friends and family often wonder why. And that's because health insurance in the United States in this day and age isn't actually insurance.
Then what is it?
Like, it was originally based on a system that was insurance, and there's certain aspects of our health insurance system that act like other forms of insurance. But when you break it all down and look at the details and important facts that matter, you will find that health insurance is not actually insurance at all. And it's a big reason why our healthcare system in the United States is so gosh darn broken.
Go to the hospital. The hospital.
Hi, my head is just killing me. My joints are all achy, and is this a hospital or?
You got hepatitis. Oh, is someone not feeling well? Your illness is very important to us.
Next.
Health Master Inferno. Cure Me Technology.
This goes in your mouth. This one goes in your butt. Hang on a second. This one. This one goes in your mouth.
I know these days I'm mostly a farmer and I make videos on the internet, but before I started this career, I actually worked for like 20 years in the financial services industry, working in pretty much every aspect of the financial services industry except for credit cards and health insurance.
One time a health insurance company offered me a job, but I turned it down. It didn't pay enough.
But I did work a lot in property casualty insurance. I did work a ton in life insurance, in the annuity industry. And so I'm pretty familiar with all of the concepts behind insurance. A lot of my friends are actually actuaries. Like, I could actually pick out about a half dozen phone contacts in my phone of people who are actuaries who I sometimes hang out with.
Ain't no party like an actuary party, because an actuary party involves math. Statistically speaking, these people be freaking and tweaking and looking at probability tables. I ain't telling no fables. I know you party round you party. You party like an actuary party, cause an actuary party involves math.
And so for all of my years working in the insurance industry, I've been saying for a very, very long time, what I started to realize is that health insurance isn't actually insurance, because insurance requires pooled risk, and then having that pooled risk help pay out when something unlikely happens.
Boring.
Insurance gathers a bunch of people together, and they all put in a tiny bit of money.
That's boring. You're boring, everybody. Quit boring everyone.
And in the unlikely instance where something bad happens to them, that pool of money is drawn upon to help pay out to those people who put in and who might have experienced that specific hardship. And oftentimes the higher risk of something was to happen and more likely it was to happen, the more that insurance coverage was going to be likely to cost.
They shouldn't even call it insurance. They should just call it in case I give a company some money in case happens.
So I actually worked out a little hypothetical example to take you guys through here. Say there was a town with 7,000 homes in it.
Glory!
Jack up, me, Dune.
And on average, you had 1% of those homes in that town catch fire.
Oh! Heavy storm, Babu!
What you mathematically could have is everybody in that town paying $500 a year and avoiding having to personally carry the risk of, say, $50,000 to fix their house after the fire. And you could pay out that $50,000 to the 1% of fires that happen amongst those 7,000 homes in that town each year. And I think insurance really plays an important role in our society because it helps make sure that undue risk isn't just squarely placed on the individual, and we as a society or as a group of people can collectively share that risk.
Why should I pay for a fire department when I have never had a fire? Let the people with burning houses foot the bill.
But the thing is, time and time again, insurance markets collapse when events are predictable. For example, a tsunami destroying all the homes on a small island eliminates uncertainty. Everyone on the island would bear the same loss, making insurance pointless. And that's why I say the health insurance of today isn't actually insurance, because nearly everyone gets sick, and sick people have perpetual medical expenses. And these ongoing costs break the insurance model because the risk pools rely on uncertainty. When everyone is guaranteed to need care, it's no longer insurance, it's just cost sharing with extra layers of bureaucracy.
I scream, you scream, we all scream for bureaucracy.
For a moment, imagine if your car insurance was actually paying not just for repairs if your car got into an accident or somebody smashed the window and stole your stereo, like the typical things that car insurance pays for. And rather, your car insurance was going to also pay for all of your oil changes, all your brake changes, any other mechanical failures you have, any sort of maintenance and management of your car and like taking care of your car. You had an expectation that your auto insurance was going to pay for it. I think that analogy is very close to what our health insurance industry looks like today.
What's a scam that's become so normalized that we don't even realize it's a scam anymore?
Private health insurance. We keep paying into the system that makes us broke. We have to keep paying more and more into the system. Doesn't deliver care, and when you actually need life-saving care, they're like, no, we can't reimburse it, and they have every way to deny your claim.
Do you want to know what I absolutely hate? Health insurance. I freaking hate it. It's not fair. I have type 1 diabetes. That's from when I was a juvenile. And I'm being punished for something that I never asked for. I didn't do this to myself. I'm tired of having to jump through hoops to always get my prescriptions and things that I need to live. No health insurances will accept me because I have a pre-existing condition.
Much like a car is always going to need an oil change or always going to need new tires or new brakes because those things wear down and it's just part of the regular maintenance, human beings are always going to have healthcare costs.
Health insurance is a scam. You can't even go to the doctor anymore, and then, so I'm just supposed to be sick all the time? I paid a $50 copay, and my insurance didn't pay all of the rest of the doctor's visit, and now I'm stuck with a $386 bill.
Can somebody please explain to me how much it costs to go to the doctor?
We are expecting our health insurance to be health care. And I think that's where a big part of the disconnect is. The insurance companies are not going to pay for you to maintain your health. Whether they should or not is a different conversation. There's a big disconnect on what healthcare and health insurance are. We have to equate it to insurance, but insurance, and it's a scam.
So do you remember when I was talking about all that boring stuff related to pooling risk earlier in this video? Well, when it comes to health insurance, what it should be doing is pooling all of the risks that a person might have related to their potential healthcare problems and spreading that risk amongst a lot of other people.
Companies are evil. They only want money from healthy people that never need to use them. And people who actually depend on it and need it to live can't get it. I am just so angry, and there needs to be something done about health insurance for people who actually need it.
Now, the reality is that most people don't fully comprehend what insurance does or doesn't do for them when it comes to medical health insurance.
We are the TV Doctors of America, and we're partnering with Cigna to help save lives.
By getting you to a real doctor for an annual checkup.
I have no idea what could have given people the impression that health insurers should pay for people's routine medical costs.
Cigna, together all the way.
And despite the fact that most Americans actually rely on their health insurance providers to support their health costs, most Americans struggle to understand their health insurance, with a recent survey finding that more than half report inadequate knowledge of fundamental key insurance terms like premiums, deductibles, and co-payments. This widespread lack of health insurance literacy has severe consequences. Many folks fail to use their plans effectively, delaying or avoiding care altogether, which exacerbates medical and financial hardships. And despite these gaps, health reform policies increasingly shift decision-making responsibility to consumers, underscoring the urgent need for systemic simplification and better public education.
And that's why these days you see so many people so completely irate with their insurance companies, because the system that we're currently working with is so gosh darn dystopian. Because it can often seem like the game is rigged for most working Americans. You know, if you're really, really wealthy, you're not going to care all that much about your health insurance costs. And in fact, a lot of rich people these days aren't even having health insurance, and they're just basically self-insuring.
6 years ago, I canceled my health insurance. We're wealthy. We want to go to the doctors we want to go to. Half the time it wasn't covered. And when it was covered, it was a ton of time and cost to get reimbursed. I was spending $55,000 a year on health insurance. Over 6 years, I have saved $330,000. I can do this. Because if I get hit with a really unfortunate, unforeseen illness, I can absorb it. Most people can't.
The health insurance that most Americans are buying is not the product they expect, nor is it what their grandparents or their parents had. It's not even what they had as children, and it's shifting faster and faster with each and every year as more and more of the burden of the cost goes to the consumer.
Doctor, my belly aches.
You got butterflies in your stomach!
Like if you go back to like the 50s, 60s, 70s, and even into the 80s, that was kind of like the golden age of health insurance. Post-World War II, there was a strong demand for more workers, and so a lot of employers went out there and offered large benefit packages that included full and comprehensive health insurance, and that health insurance often covered all of the healthcare costs. Like a factory worker in 1974 was not thinking about deductibles or in-network coverage or out of coverage. They just got sick or got hurt and they went to the doctor and they got it taken care of. Their kids got sick or got hurt. They would just go to the doctor and it would get taken care of. And for the most part, you did not have the dysfunctional system that is pushing people to the brink that it is today. But really, starting in the 1990s, employers started to shift the benefit burden more and more towards the employees. You know, on the retirement side, you saw defined benefit retirement plans disappearing and shifting to things like 401k plans and defined contribution plans. And for most employers, their single biggest non-salary employee cost is going to be health insurance these days. And so they shifted more and more of those costs to the consumer. By 2023, employees paid 29% of their premiums, up from 17% in 1999. High deductible plans exploded from 4% of workers in 2000 to 30% today. The workers of today pay more out of pocket for less coverage than their parents did. That is an objective fact.
Have you ever wondered why the U.S. never adopted universal health care when pretty much all other developed countries have? Before the mid-1900s, medical care was neither advanced nor expensive, reducing the demand for health insurance. During World War II, labor shortages became a significant issue due to the draft. To manage inflation, President Roosevelt froze wages in 1942. Unable to increase salaries, employers began offering health insurance as a benefit to attract workers. In 1943, the IRS declared these benefits tax-exempt, further incentivizing the practice. Meanwhile, nations in war-torn Europe and parts of Asia implemented universal healthcare systems as part of post-war reconstruction. However, the U.S., with its booming economy, faced less pressure to make similar changes. When President Truman proposed a national healthcare system in 1945, despite popular public support, opposition arose from influential interest groups, including businesses and unions. It's wild to think that America's healthcare system is basically a World War II souvenir.
Like, even as I compare my health insurance that I had with like my first real job back in 2005 at a Fortune 100 company, which was actually really good and really solid. And I could like go to a doctor and see a doctor and get stuff taken care of. And I could break my ankle skateboarding and like all of that stuff would be covered. And I didn't like get saddled with a whole bunch of debt and problems. But then when I look at my last full year having health insurance from a large corporate employer, which I guess was back in 2021, what sort of coverage I had then was absolute garbage compared to what it was when I was 25. And the increase in costs and the increase in deductibles and the weird complex rules didn't change because I got older. It changed because the system changed. And I actually saw this firsthand when I was actually working on the management committee of an investment company back in the mid-20-teens, where every year, like all of us, like folks who reported to the CEO, we would sit down in a meeting with the head of HR and we would look at the benefits, costs, and expenses and figure out what we could afford to pay and how much we would have to push to employees versus how much the company would absorb, because the rates were always consistently going up. And, you know, we would try to strike a right balance, and so as the health insurers pushed more and more costs to the employers for the plans, the employers pushed more of those costs down to the employees. And that shift that started, like I said, in like the 1990s and continued into the 20-teens, like the post-Affordable Care Act, Pablo, that is what brought us to the dystopia we're in today. And what's interesting is I was actually talking to some folks who are my parents' age recently about health insurance and the problems with health insurance coverage. And they almost like didn't even seem to fathom it, because so many of them spent most of their working careers where the health insurance wasn't all that bad. And eventually they got to the point where they could go on Medicare, and that was how they were covering most of their healthcare costs.
Okay, boomer. Okay, boomer. Okay, boomer. Okay, boomer.
And so again, it isn't all Americans who have to suffer these health insurance problems. You know, older folks don't have to deal with it. And it's not to say that our veteran healthcare system is perfect. And I absolutely believe because of their service, they earned that coverage. But when you compare what a U.S. veteran has for a healthcare system to what a ordinary citizen in Canada has for a healthcare system, it's actually not all that different. And now I say all of this to you guys in an exceptionally frustrated tone of voice. It's because I see several different forms of healthcare coverage in other parts of the world that, while they might not be perfect, they are significantly better than what we've got. For example, the single-payer system they have in Canada, the biggest criticism you'll always hear is it's hard to get an appointment, and you often have to deal with waiting times.
I'm going to explain to you why free healthcare in America is going to kill you physically and financially. And these are all based off of countries that already have free healthcare. In a lot of countries with free healthcare, you end up waiting upwards of 8 hours just for like a strep throat test.
I do not want universal healthcare. You know, over there in Canada, they wait months to get their surgeries. That's ridiculous. I do have a serious back condition that requires surgery. Problem is, specialists I won't get into, I can't, because he ain't covered under my insurance. So I got to go to a different guy over there in Colorado and pay to get out there and see him. Problem is, I'm a new patient, so I can't get in for about 6 months. He booped out. He's going to fix me up real good. Can't walk right now, though, of old work. So in the meantime, he's put me on some Oxy. I'm feeling great. But you know, that is the price you pay for having the best healthcare in the world.
There is a ton of research looking at how universal coverage systems affect wait times. Study by the Commonwealth Fund compared the United States to 10 separate countries. And if we think that we're sacrificing timeliness for universal healthcare, the United States should have the lowest percentage in these metrics of timeliness. The United States is doing the worst in most of these metrics. Even though the US does not have universal coverage, it has some of the worst outcomes when it comes to wait times.
And meatheads out there are going to go on and on about how they prefer the choice and flexibility and the ability to get what they want as the consumer in America. And while in theory, I think that's a nice thing to say to yourself to make you feel better about our crappy healthcare system, the reality is it doesn't play out that way.
The United States consistently spends the most money on healthcare and also consistently gets the poorest results on its healthcare scores when compared and benchmarked to other similar countries.
Because you oftentimes have to wait for approvals from a for-profit insurance company. You have to then try to find availability for doctors who might take your insurance. And, I live in a particularly rural area, and finding healthcare providers in general, but especially trying to find specialists for specific needs that you might have, it's really difficult, and it can take a year just to get booked into a place. Like, I'm still trying to go see an allergist because I have a cat allergy and I would like to start getting treatments, but they don't have any capacity for me until next year. And so yes, the waiting times in Canada might be frustrating and inconvenient, but they're also not that much worse than what we experience here. But they also have the added bonus that nobody in Canada is going bankrupt because of their healthcare costs.
I declare bankruptcy!
You probably already know this, but the number one cause for bankruptcy for American families is unexpected medical costs and high health costs.
Around 66% of bankruptcies filed each year are due to medical debt, which is about 500,000 cases per year.
50% of families whose child has cancer go bankrupt in this country.
And so this really is a problem that is ruining things for a lot of good folks who are otherwise living their lives and doing kind of the right things. But inevitably, if you get that $10, $20, or $50,000 hospital bill plunked down on you and your family because of something that just happened, you've got to just suck it up and deal with it.
Okay, so call me crazy, but what if we just stopped letting people go bankrupt because of their healthcare expenses? What if we just stopped doing that? Everybody knows that we could do that, right? Other countries around the world do it, and yet people still go bankrupt because their kid has to stay in the NICU and their insurance is denying some sort of claim.
So medical debt is the leading cause of bankruptcy in the United States.
Yeah, those bills be high.
And when you go bankrupt, your medical bills are exhausted.
Yeah, non-priority unsecured debt.
When the medical bill is exhausted, the hospital doesn't get their money.
Correct.
So they pass that savings along to their billing in the form of higher prices for every other patient.
Yes.
Doesn't that just amount to a very, very inefficient tax on the upper and middle class?
Not if you never get sick.
And when it comes to the American health insurance system, it's not just the unexpected costs that are there. The unexpected hassles are also maddening. When you look at the challenges of trying to find a new primary care provider or go see a specialist because you have something.
Does this look infected to you?
Or you look at the hassles that people have to go through for getting bills submitted or getting pre-approved for a procedure, or even some of the crazy policies that a lot of insurance companies are rolling out these days.
A Senate report released a little over a month ago found that United Healthcare, along with CVS and Humana, were using AI and technology to deny people who were on Medicare Advantage from receiving post-acute care services.
In America, health insurance doesn't always mean health care. Right now, 1 in 7 claims gets denied. Imagine that. Insurers have their own doctors, their own rules, and their own playbook for saying no. Data shows that for plans on healthcare.gov, about 17% of claims get rejected. That's a lot of people left scrambling to fight their insurer, and only 0.2% of them formally appeal. Most just give up.
Anthem Healthcare, it's an insurance company. Well, what they're doing now is capping the amount of time you can have for anesthesia during a surgery or a procedure. It's true, it's serious, it's happening. So there's a time limit now for anesthesia if you're having surgery.
Like the idea that health insurers are actually out there in this day and age figuring out how long people are allowed to have anesthesia for a procedure just seems insane. Now, I am no medical expert, but it seems like there are so many gosh darn variables out there for somebody who's undergoing a procedure that how can you know exactly how long they're going to need anesthesia for? And are you really saying that a person has to stop using anesthesia while they're like open up on the operating table, or even worse, they suddenly become liable for any bills created beyond a certain time threshold when they're out and unconscious to begin with, so they can't even consent to something like that? All of this stuff just absolutely defies logic. I cannot fathom for the life of me how we as an American people have not just had a full-on revolt to change our healthcare system.
Breaking news.
An all-out manhunt continues in New York City for the suspect who gunned down United Healthcare CEO Brian Thompson outside of this hotel on Wednesday morning. And there could be key evidence that was found on the shell casings. The New York Post reporting the words "deny, depose, and defend" were written on those casings found at the scene.
Interesting that one of the shell casings had the word "deny" written on it. And it made me think of the time they tried to deny coverage for my mother's dialysis.
I've actually been working on this video and everything that you're seeing here today for a few weeks, and it just so happened that the really sad event in New York where the United Healthcare CEO was assassinated on the street.
Police say this was definitely a targeted shooting, and they now believe the motive could be a grudge against the insurance company. In the surveillance video, the victim walks by when the suspect comes from behind, points the gun, and shoots.
Like, not to be ambiguous about this one, I in no way think that that is okay. I think it's a real tragedy. I feel bad for his family and his wife and his kids and like friends and colleagues. I can't imagine just how traumatic that experience must be for them. But if you want to ever see something really unnerving, go take a look at any tweet or TikTok video or news article that has a comment section still focused on this story.
Holy hell. I have never seen a more macabre group of comments than I have today on a posting of a man who was brutally murdered in near broad daylight on the street of New York City.
Oh, that's terrible.
So before anyone gets their panties in a twist, I'm not saying that you should assassinate people.
So you can't see at all?
Huh?
You can see though, right?
I'm legally blind, I can see, barely.
I have never seen Americans so united on something as I have over the last 24 hours in the comment sections on these news articles about the United Healthcare CEO. And this is across the political spectrum.
And the number of people who are actually celebrating an awful situation like this is astonishing. And again, while I think it is sad and I think it's horrible to see anybody removed from this earth through an act of violence like that, I also kind of understand where a lot of these people who are commenting are coming from.
I am really struggling to find some sort of empathy for the United Healthcare CEO and him being unalived. But as somebody whose family uses United Healthcare and has been denied access for medical stuff, especially for people in my family who have autoimmune diseases and chronic health conditions where it's life or death when it comes to their medicine, I'm having a hard time being empathetic to the situation whatsoever, because this is a billion-dollar company, okay, that denies access to people every single day and tells people whether they live or they die.
These are folks who have their backs up against a wall, who are struggling to make ends meet. They're seeing health insurers and folks like this Brian dude rake in millions of dollars in pay packages and not have to worry about the healthcare, welfare, or bankruptcy for their family.
It's worth mentioning that when the CEO of United Healthcare, the insurance part of United Health Group, was rushed to a hospital, it was Mount Sinai, who was removed from United Healthcare's network. If he was a civilian, he would have been hit with a massive bill.
And so when they see a professional hit job happen in broad daylight as a guy's walking to go to his investor day call,
they stepped over his body and started the meeting on time. He was in Manhattan at 7 a.m. for an 8 a.m. investor meeting. He got in front of the main doors.
Did you also know that that meeting he was going to was for market investors, talking about 2025 plans to increase profits of a healthcare insurance company by $5 billion in 2025?
They stepped over his pool of blood. They kicked the shell casings that led to the end of his life down the street because the meeting still had to start on time.
3, 2, 1.
It's all definitely giving out some strong French guillotine vibes. Health insurance in our healthcare system as a whole has become a tangled web designed to make the consumer pay more and make the insurer pay less. And that is entirely by design on the part of the health insurance companies. Because as I said earlier, you have an industry that rakes in billions and billions of dollars in profits every single year. And those profits do not go to the hospitals or the doctors or the pharmaceutical companies. Those profits don't in any way get kicked back to the policyholders or to other people in the community. Those profits specifically only go to enrich the shareholders of those insurance companies. And those shareholders have an expectation of consistent, ongoing growth in earnings and accretive value of the company.
My boy Squiggle cooked up this beat for me. Check it.
Maximize the shareholder value, that's what we do. Your EBITDA looks kinda whack. Debt restructure, share buyback. Screw the customer, that's tried and true. Maximize that value, yeah, it's what we do. Deny that claim, G, the less to pay, the more we maximize value.
Brownstones, water towers, trees, skyscrapers, prize fighters and Wall Street traders.
IB Flex and EBITDA is our tool. Stay liquid, cold plunge, keep it icy cool. Leverage my position, keep that equity tight. While you're stuck in analysis, I'm catching the flight. Pivot that table, alt temp to the formula tab. You ain't going to the gym, you're all covered in flab. Maximize that value, yeah, it's what we do. Earnings per share, bro, we coming on through.
It is burning my eyes, but I cannot look away.
And the management of those insurance companies have an incentive, both personal and institutional, to keep driving growth in their earnings numbers. And there really is only two ways to increase your company's earnings. Either you increase your revenue or you find ways to decrease your expenses. And when you're an insurance company, your biggest expense is always the claims that you have to pay.
We need an MRI to see how the tumor is behaving. The insurance company will deny it. I will call them. I will say the patient needs why, because of it. And I have to argue for 45 minutes. Yeah. Guess what I don't get paid for as a doctor? If you're a lawyer, Are you doing anything for 45 minutes without getting compensated? Most doctors will try, and then we fail. So then we start trying to hire administrators to do it for us. And that is why healthcare costs have ballooned in this country. I'm a doctor. I do science. I do the body. I don't do codes.
Again, the objective of the insurance company is not to pay.
As somebody who's worked in the benefit space for almost 10 years, I have seen even people who have coverage be denied claims. Like, insurance companies literally just tell them, no, we're not covering it. It is not only frightening, it is maddening, because you're literally paying for something that they're just like, no, we actually won't. We're not gonna do that because we actually want to keep the money.
Hello, Blue Cross? Yeah, I just got paid for the breast reduction I did a month ago, and why did I get paid full for the first breast, but only 50% for the second breast?
That's correct. We routinely pay 50% of the fee for the second breast.
But that doesn't make sense. I did the same surgery for each breast.
Yes, and?
Why don't I get paid the same for the second breast as for the first breast?
Because that's not how it works.
So what if I operate on one breast on one day and the second breast on the next day? How much would I get paid then?
You'd be paid full price for each breast.
So you're telling me that if I do both breasts on the same day, if I do the right thing for my patient, I get paid less than if I separated the surgery and did the wrong thing for the patient?
Yes.
Insurance companies make billions and billions of dollars every year. How is it that people don't understand that all those billions in profits going to a few people would not be better distributed back into the healthcare system?
I'm having trouble reconciling these two facts. Can anyone help me?
Particularly as you have people living longer and longer and people using more medications to help them in their day-to-day lives, covering people in just their basic preventative healthcare maintenance and those costs has skyrocketed, particularly in the last 30 years. And so that fact started to have them rethink and reprice how they think about the risks of health and how they think about the costs that Americans would have to accumulate when they get sick or when they have a problem. And it forced a lot of health insurers to adjust what sorts of coverage they will pay and what they won't pay. And that fact also motivated them to shift a lot of their practices in a way to try to screen out and filter out and essentially get people to drop out of the system and give up on their claims to help save those health insurers money, because the vast majority of the health insurance industry is a for-profit, publicly traded industry making billions of dollars every single year, and the management of those companies is getting paid to help maximize those profits for their shareholders, and that will often come at the expense of their policyholders, and it actually frustrates a lot of medical providers to the point where they don't want to work in the industry, and as they're quitting that industry, having fewer medical providers, it only exacerbates all of our other healthcare problems. Like my wife, she's actually a nurse practitioner, and so she works in the emergency department of our local hospital here. And there are so many procedures and things that she might have to do and make a split-second decision on whether or not she needs to do that for that person in order to save their lives. And when she's doing those things, if that person is conscious, she probably is not going to be able to even tell them how much that procedure is going to cost. Because the actual answer is that it depends. Depending on who's paying for it, it changes the price. Depending on what sort of network coverage or non-network coverage exists, it changes the price. She does not know how far that person has spent against their deductible for the year, so she doesn't know if they only need to spend $500 more before everything's covered, or no, they've got to hit like $10,000 or $15,000 in a deductible in that year before anything gets covered, and so suddenly they're getting like a $10,000 bill. Like, as the healthcare provider on the front line dealing with people in the emergency room, she does not have access to that information to actually make the person who is sick or injured or those people's families understand a lot of the financial implications of the decisions that have to be made on very quick notice. So when you see folks out there saying that people need to just be better consumers of their healthcare, I think they're completely misunderstanding how healthcare gets delivered in the United States these days. Like, the number of people who are actively out there having to dedicate their time and energy to fighting insurance companies for things that the insurance companies should be paying for is mind-boggling, but it also makes perfect sense when you look at it from the insurance company's perspective. You know, when I actually used to work in like designing experiences and like websites and e-commerce stuff, there was always this idea of breakage, right? Where like you wanted to prevent people from falling out of your purchase system. Like, your goal was to make it as easy as humanly possible for that potential client to give you their money. And so you would try to do everything you could possibly do to remove the friction in the process.
Wow, look at this place!
Well, hello there! Looking to get some insurance?
No, my friend's mom already has insurance with your company.
Oh, you want money from us? Right through that door over there.
And like, if you look at health insurers, whether it be like a CVS Aetna or a Cigna or a United Healthcare, like all of them have web experiences that on the front end to get hooked in and to get connected are actually pretty easy and pretty simple to use. But when you look at their back end to deal with claims and address problems and address questions and to use services and to do all of the things that are going to cost the health insurance company money, they are suddenly very, very complicated, very, very arcane, very, very complex, and very, very hard to navigate. And don't think for one moment that that was an accident. Don't think for one moment there aren't various people from product executives to marketing executives to web and tech folks who are being compensated and incentivized to actually make some of these complex systems even more complex, to reduce the number of claims that get filed, to reduce the amount of healthcare spend that the insurer might be liable for. And essentially, what they're looking to try to do is minimize their bill so they can maximize their profits. Like, it's business 101 that's what you want to do. Like, that's how you make money. But when you leave these types of things up to for-profit insurers, they're going to constantly look for every little way to increase their profitability for their shareholders, as they should. That is their objective. That is what their founding principle and belief is. But it makes zero sense to me to leave that sort of public welfare in the hands of a private institution and a privately motivated group like that. And I attack the health insurers and our health insurance system in this video not to let other culprits off the hook. You know, our hospital system, our food system, our USDA system, our pharmaceutical system, our education system, like all of these other players are definitely villains in our broader healthcare problems. But to just give this video a tad of focus, I truly believe that the health insurers are number one of the biggest creators of those problems, and number two, the easiest group to extract from this system so that they're no longer a problem. And that's not me saying we need to get rid of the health insurance industry. I actually think we should have a private health insurance industry where people, if they have the means to do it, can go buy supplemental coverage to help improve what sort of healthcare outcomes they have because they want to spend their money that way. And I think in a free society, they should be able to do that. I'm just struggling with the justification for having these blood-sucking vampires embedded in our healthcare system, and I fail to see the advantages that they provide relative to just having the government do it. And again, to be exceptionally clear, I'm not saying have the government run hospitals, I'm not saying have the government be actual healthcare providers, but to have the government play the role of the health insurer, which is already something that they do for millions and millions of Americans, it just kind of makes sense to me. The complexity that health insurers introduce to our healthcare system also, I think, makes it actually a lot more opaque. Our health insurance here in the United States is worse than it was 20 years ago. And if you think it's going to be any better 20 years from now, you are 100% delusional and you are missing where the trend line is going.
So we have a system today that despite spending twice as much per person on healthcare, we don't have enough doctors, we don't have enough access. We spend hundreds of billions of dollars filling out forms rather than hiring the doctors and training the nurses and the dentists that we need. Now, is it free? Of course it's not free. We fund it publicly, like you do your fire department, like you do your police department. And healthcare should be funded that way because it's a basic human need.
And I know that there's going to be some bots in the comments section of this video going on about how the healthcare systems in Canada, the UK, and Australia, and France are all inferior. But that is not true, and that is divorced from the facts. Because if you actually look at it, America spends roughly $12,000 per year per American for healthcare costs, which is nearly double what most other developed countries pay. And if you look at the statistics on health outcomes, they are significantly worse for Americans. I genuinely believe that the people out there who are still arguing for our existing health insurance and healthcare system, saying that it's the best in the world, are either ultra rich or getting duped by the system, and they're getting duped so hard they don't even know it.
You're getting duped. Oh, you're getting duped. They're dealing from the bottom, and you're getting duped.
So just a yes or no, you still do not have a plan?
I have concepts of a plan.
So I doubt I'm convincing anybody to think differently about health insurance with this video. Like, I know there's going to be people in the comments who support a universal healthcare system, and they're probably just saying bravo. But then there's also going to be people who are probably tearing down some of the things that I've said, and they're going to attack me personally or try to pick apart an idea versus step back and look at the big picture. And I challenge anybody in the comments to explain to me how the U.S. healthcare system is better for most Americans. Like, I am asking because I am genuinely curious, and I think that this is one of the biggest problems our society is going to face over the next 20 years. And if we don't start having a collective dialogue to say, how do we find a place of compromise and how do we find a system that is more sustainable than the completely messed up system that we have today, all of these problems are only going to get worse. Thanks for watching, everybody. Oh, by the way, if you want, there's a couple other videos you might find interesting if you've never seen my videos. I hope you like them. They're not all about health insurance.